Okay, we're going to pick up on the second part of chapter 8, where we're going to start talking about surgical terms and the rest of the chapter. Again, built from word parts means you know how to break these down and get a definition for them. The next part we're going to talk about are the surgical terms not built from word parts. Before we go any further, I want to show you this. These are different scenarios in terms of surgeries that would involve removal of any or all of the parts of the female reproductive system. If a person is having what they call a total hysterectomy, that would be this one, where they take the uterus, the fallopian tubes, and the ovaries, and they take all of that out. In this case, here they're just taking one side of the fallopian tube and the ovary. Here they're taking just the fallopian tubes and ovaries, and here they're taking just the uterus. You don't want to remove any more of the organs than you need to, because especially like in women, the ovary is the one that actually produces the hormones, so you really don't want to remove ovaries if the problem is only lying within the uterus. So they'll do different versions of what they call hysterectomies based on the actual problem that the female's having. So some surgical terms not built from word parts. Again, I'll list these on the exercises. Want to go over a couple of things. This dilation and curettage. You'll hear a lot of times a woman's having to have a D&C, and that's what that is. A tubal ligation is basically the equivalent to the male vasectomy. They go in and they cauterize or cut off part of the actual fallopian tube so that the egg can't travel to the fallopian tube, therefore it can never be fertilized to result in a pregnancy. And this is where they show in the actual tubal sterilization. Notice they remove the section here and they cut these two off. There's no way for the egg to then travel down the fallopian tubes and end in fertilization because it's an empty pathway. All right, here are a couple of diagnostic terms built from word parts. Most of them you're going to see are scopes and scopy, and that's usually what they'll do for diagnostic things for the female reproductive system, except of course for the breast, that's going to be the mammograms. Here's a picture of a mammogram. It's just a plate that actually flattens out the breast tissue so that they can get a better picture. And I don't know about you, but if I were the one, this one little spot right here is what they're looking at in terms of cancer. So that shows you the size that they're able to detect in relation to the fact that, you're supposed to do a monthly manual breast exam, but of course you would never feel that. That's why they recommend mammograms. Laboratory terms, CA-125 and a pap smear. Pap smear is going to be used to diagnose cervical cancers. CA-125 if they have any reason to believe there's any type of ovarian cancer. That's a diagnostic blood test. And here's what they do to go in and do a pap smear. They'll take a scraping from the cervix, which is right up in here. Okay, last bit of this chapter, we have the complementary terms, built from word parts and not built from word parts. I think everybody is familiar with premenstrual syndrome, PMS, and this one's another big one, HRT, hormone replacement therapy. That's especially important for women after menopause. Our abbreviations, again, I've listed them for you, so please pay close attention to those abbreviations as well. This is going to be, like I said, this is the final part of this class. We're going to pick up with the next class, right? That will begin with chapter 9. So just let me know if you guys have any questions.